Yeah. Good morning, Joe Roble here, once again with the fabulous Dr. Newhaven of Northwest Indiana Chiropractic. He's here to talk to you about knee pain and some ways to alleviate it and proper ways to do things. Good morning, doctor.
Morning, Joe. Thanks for having me.
Excellent. So why don't you go ahead and tell the great people of the world some of your tips and techniques of how to alleviate pain and squat and all that good stuff that you've been telling me about.
Well, knee pain is a big problem for a lot of people in this society, and one of the main reasons for knee pain is overloading of the knee from not squatting right. So essentially, life is squatting. When you sit down on the toilet and get up off the toilet, what are you doing? You're going in and out of a squat. Every time you go up and down the stairs, essentially what you're doing is a one-legged squat. So even, if you don't think you're squatting. And so it's about the quality of the squat going forward. And a lot of times we lose that and we just, we overload our knees. And I can actually show you an example of what I mean.
Let me get out of your way here.
Yeah, adjust the computer. And so a lot of what a good squat looks like is the knees don't go past the toes. And we come down like such. So what a lot of people do when they squat is this, right? They're on their toes and their knees are way out here in front of them. Well, that puts a lot of anterior shear on the knees, and I don't care if you have the strongest knees in the world, eventually they're going to wear down because this is bad. It's much different than this, where the knees are nice and lined with the toes and the butt's down. And what I tell people is, if you watch how a baby or a child squats, do they squat with their knees way out here like this? No, they don't. They squat nice and beautifully like this. And that's how we're supposed to squat, because that is what protects our bodies and especially our knees. And the next time you go up and down the stairs, just watch where your knee lines up when you're going up. Is your knee all the way out here in front because you're on your toes? If so, you're going to cause yourself some knee pain, whether it's you already have it or in the future or a couple of years from now. Eventually it's going to happen. So instead of, if you watch this, just driving up with a nice flat foot, keeping the knee behind the toe, and just driving straight up. So that is essentially what it should look like, not this. And I have a problem even doing that, so I don't know how so many people do it. It's amazing. But that's one of the, not squatting right with two legs or one leg is just a huge problem nowadays. And so you're seeing me take this half knee a lot. My quick tip for the day is, instead of trying to squat down in your bad form to pick something up, or you're going to squat like this and hurt your back, take a half knee. It's nice and safe for the knee. It's nice and safe for the back, and you can still, if you've got to pick something up, you can still pick it up, hold it into your body, and then drive up with your butt muscles. And so, you do have to have some leg musculature to do this. So this is actually something, I've taught 70 and 80-year-old people to do just as well as young people. It's, what you can do is start next to a chair or even a wall, and you can just start with your legs kind of wide and just work on strengthening your form a little bit and getting a little bit lower and a little bit lower until you're able to go all the way down, pick something up, and come back up. So if you watch my knee the whole time, at no point does it ever go past my toe. So instead of bending down, try taking the half knee next time. So it's just a really quick, easy tip, and not, if you're having a lot of knee problems, this still could cause you problems, but what it will do is start unloading that knee for you and start to give you potentially a little bit of relief. So once again, this is just a quick tip. If you have knee pain that's lasted longer than 48 hours, it is not normal, and I would definitely recommend an evaluation by someone such as myself.
All right. Thanks, Doc. Get yourself a workout there.
Absolutely.
Once again, tell the great people how they could find you if they have any questions or concerns.
Once again, Dr. Bob Newhaven of Northwest Indiana Chiropractic. You can visit my website at nwichiropractic.com, or you can call my office and schedule an appointment at 219-322-6942.
There you have it, folks. Dr. Newhaven, thank you as always. Been educational.
Thanks, Joe.
All right. Have a great day.
Have a great day, folks.